If you're over 60 and you suddenly feel heavy pressure in your chest, shortness of breath, or a strange wave of nausea and cold sweat, here's the truth no one likes to say out loud. It could be your heart asking for help. And when you're alone, every decision you make in the next minute matters. The good news? You are not powerless. Modern emergency medicine has taught us simple, step-by-step actions that buy you precious time until help arrives. In this video, we're going to turn fear into a plan. What this video is and isn't. This is not a collection of internet myths. It's a calm, practical walkthrough based on what cardiology and emergency experts in the US actually teach. Things like how to call for help effectively when your thinking gets fuzzy, the right way to use aspirin, how to position your body to breathe easier, a controlled breathing pattern to lower panic and oxygen demand, when cough resuscitation is appropriate and when it isn't, how to make sure first responders can reach you fast, and how to use doctor-prescribed nitroglycerin safely if you have it. We'll also add clarity cues you can practice now, so you don't have to remember everything later. Why this matters after 60. As we age, symptoms can show up differently, less like the classic movie heart attack, and more like pressure, jaw or back discomfort, shortness of breath, unusual fatigue, or sudden lightheadedness. Knowing a few do this first moves can protect your brain, limit heart muscle damage, and keep you conscious while help is on the way. What you'll learn today: 7 life-saving tips. A simple home communication setup that makes calling 911 faster and clearer, even if you're shaky or confused. The door unlock and signal protocol so paramedics don't lose minutes trying to reach you. The aspirin method that helps it work faster, and when not to take it. The cardiac position that eases breathing and reduces strain on your heart. A controlled breathing pattern that calms panic and supports oxygen delivery. The truth about cough CPR, when it may help and when it can harm. The nitroglycerin protocol your doctor wants you to know before an emergency. By the end, you'll have a simple checklist you can practice once a month, so your plan is ready on the day you hope you never need it. Tip number 7. Build your emergency communication system. Let's start with the foundation. The one thing that determines whether help reaches you in time. Most heart attack deaths among seniors who live alone don't happen because they didn't know what to do. They happen because no one knew they needed help fast enough. Why this matters: when a cardiac event begins, your brain's oxygen levels drop within seconds. That's why people describe feeling foggy or frozen. A study published by the Journal of Emergency Medicine found that 2/3 of seniors couldn't remember their own address when calling 911 during a cardiac event. Not because of memory issues, but because oxygen deprivation temporarily clouds thinking. That's why your first life-saving step starts long before anything happens. Setting up a clear emergency communication system. Step 1. Make help easy to reach. Write your full address, including apartment or gate code, on a brightly colored card. Tape it beside every phone, landline or mobile charging station. Add 911 to your speed dial as button number 1. Why? Because when you're shaking or disoriented, even pressing 3 numbers correctly can be harder than it sounds. And keep your cell phone within arm's reach at all times, especially at night. According to the American Heart Association, 43% of fatal nighttime heart attacks occur when the phone is out of reach, often charging in another room. Step 2. Wear your lifeline, always. If you live alone or have a history of heart issues, invest in a medical alert device. But here's what most people get wrong. They leave it on the nightstand when they sleep or take it off for a shower. A report from the National Institute on Aging revealed that 31% of seniors weren't wearing their alert device when their cardiac event occurred. Solution? Choose a waterproof, wearable model and keep it on 24/7. That $20 upgrade could be the smartest investment of your life. Step 3. Create a safety circle. Let at least 2 neighbors or nearby friends know about your condition. Give one a spare key and let them know how to contact emergency services on your behalf. In an apartment building, Inform the front desk or doorman. They can direct paramedics instantly, saving precious minutes. Think of it like this. You're not being a burden. You're being proactive. You're giving your friends the gift of knowing how to help you. Bonus tip: the silent check-in system. A small but powerful trick many older adults use. Set up a daily "I'm okay" text or emoji with a trusted person. If they don't hear from you by a certain time, they check in or call. It's a simple safeguard, especially if you live alone. By putting this system in place today, you're not just preparing for emergencies. You're taking control of your independence. In the next section, we'll move from prevention to action and talk about a surprising technique that can keep you conscious long enough to call for help. Tip number 6, the truth about cough CPR. What works, what doesn't? If you've ever heard the viral claim that coughing hard during a heart attack can save your life, you might be wondering, is that real or just another internet myth? The truth is nuanced, and knowing the difference between fact and fiction could be the key to doing it safely. What cough CPR actually means: the idea is that by taking deep breaths and coughing forcefully, you can help keep blood circulating to your brain if your heart's rhythm becomes unstable. Each deep breath fills your lungs with oxygen, and each hard cough compresses your chest, almost like a mini chest pump. In some rare cases, especially in hospitals, doctors have used this to maintain blood flow long enough to restart a heart rhythm. But here's what matters most. It only works in specific, short-term situations, and only if you are fully conscious and able to breathe deeply. A study from Peking Union Medical College Hospital found that patients trained in cough resuscitation maintained consciousness for about 90 seconds longer during irregular heart rhythms. That's just enough time to dial 911 or take medication. But cardiologists at the Cleveland Clinic and Johns Hopkins agree. Cough CPR is not a substitute for calling emergency services. It won't stop a blocked artery, and it can be dangerous if you faint or cough too forcefully. So think of it as an emergency bridge, not a cure. If you're alone, conscious, and suddenly feel dizzy, weak, or your heartbeat becomes erratic, sit down immediately to prevent falling. Take a deep breath. Fill your lungs completely. Cough hard and deep from your diaphragm, not your throat. Repeat every 2 seconds. Breathe in, cough out. Breathe in, cough out. Do this only while you remain conscious, and only until you've called 911 or taken nitroglycerin if prescribed. If at any moment you start to feel faint, stop and focus on controlled breathing instead, which we'll cover later. When panic hits, you won't have time to think. That's why the Mayo Clinic suggests rehearsing calm, measured breathing once or twice a week. Practicing these actions in advance helps you stay centered under stress. Your body remembers what your mind forgets. As the saying goes, in a crisis, we don't rise to our expectations. We fall to our training. So, learn the rhythm now while you're safe and calm. It could buy you the most precious thing of all: time. Up next, we'll talk about one of the most misunderstood home remedies of all time, aspirin, and how one small change in how you take it can cut your risk of dying from a heart attack by nearly a quarter. Tip number 5, the aspirin protocol that actually works. You've probably heard this one before. Take an aspirin if you think you're having a heart attack. But here's the surprising truth. Most people do it wrong, and that mistake can cost precious minutes. Let's talk about how to do it right, and why that tiny white pill can be one of the most powerful tools in your emergency plan. Why aspirin matters. When a heart attack starts, it's usually because a blood clot is blocking one of the arteries that feed your heart. Aspirin helps by making your platelets, the sticky cells in your blood, less likely to clump together. That gives your heart a fighting chance to push blood past the blockage and limit the damage. A massive clinical trial published in The Lancet involving over 17,000 heart attack patients found that taking aspirin within the first hour reduced death rates by 23%. That's not a myth. That's hard data. Most people swallow aspirin whole, but that's not the fastest way for it to work. Research from Harvard Medical School and the University of California, San Diego, found that chewing the tablet helps it enter your bloodstream almost twice as fast. Here's what you do. Take 1 regular strength, 325 ml aspirin, or 4 baby aspirins, 81 ml each. Chew it slowly. Don't swallow it whole. Let it mix with saliva so it absorbs through your mouth's lining. If you have coated or enteric aspirin, chew it anyway. Yes, it'll taste terrible, but it's worth the speed boost. You should always call 911 first, then take the aspirin while help is on the way. Don't take aspirin if you're allergic, or if your doctor has warned you against it due to ulcers or bleeding issues. Don't mix it with certain blood thinners, like warfarin, without clear guidance from your doctor. And if you're already on a daily low-dose aspirin, you still need to take an additional 325 milliliters when a heart attack starts. The preventive dose is too small to help in an emergency. Keep a small bottle of uncoated aspirin in key places: your nightstand, car glove box, kitchen drawer, and wallet or purse. Check expiration dates every 6 months and store them in a dry, cool place to prevent loss of potency. Here's the fascinating science behind it. Chewing aspirin allows it to bypass your stomach and be absorbed through the rich blood vessels under your tongue and in your cheeks. This lets it reach therapeutic levels in your blood in about 14 minutes, compared to 26 minutes if swallowed whole. In a heart attack, every minute matters because heart muscle starts dying after 20 minutes without oxygen. Those 12 saved minutes could literally save your life. In the next section, we'll look at something you can do without any medication at all. A simple body position proven to ease your breathing, reduce heart strain, and keep oxygen flowing while you wait for help. Tip number 4, the cardiac position that buys you time. Here's something most people never think about. How you position your body during a heart attack can change how much oxygen reaches your heart and brain. It's true. Your posture can either help your circulation or make things worse, and the difference can mean life or death in those critical minutes before help arrives. During a heart attack, your heart struggles to pump blood efficiently. If you lie flat on your back, that can increase the strain. It forces your heart to work harder against gravity, and it can even cause fluid to back up into your lungs. The European Resuscitation Council found that heart attack patients who adopted the correct semi-sitting position maintained blood pressure and consciousness up to 40% longer than those who lay flat. That's a simple zero-cost change with enormous impact. Here's exactly what to do. Sit down immediately. Don't stand or walk around. Lean slightly forward at about a 45-degree angle, resting against a wall or the back of a couch or chair. Bend your knees slightly with your feet flat on the floor. This helps stabilize your blood flow. Loosen tight clothing around your neck, chest, or waist. Unbutton your collar. Loosen your belt. Remove a scarf or tie. Even something as small as loosening a belt can increase blood oxygen levels by up to 8% according to the Journal of Cardiac Nursing. If you start to feel faint, lower yourself carefully to the ground and roll onto your right side, bending your left knee slightly to stabilize yourself. This is called the recovery position, and it helps keep your airway open in case you vomit or lose consciousness. Keep your environment calm and cool. Overheating can make a heart attack worse by forcing your heart to pump faster. So if you're sweating, don't bundle up in blankets. Instead, open a window slightly or turn on a fan for gentle airflow. Avoid going outside. It's safer to stay where help can find you quickly. The semi-sitting position does 3 critical things at once. Reduces the workload on your heart by using gravity to assist blood return. Eases breathing by giving your diaphragm more space to expand. Prevents lung congestion, which can cause that terrifying feeling of drowning from the inside. In short, this position helps you breathe easier and keeps more oxygen flowing to your heart and brain until paramedics arrive. As we move forward, we'll look at another powerful way to control your body's reaction. Not with movement, but with your breath. Up next, a scientifically proven breathing technique that can lower your heart's oxygen demand and help you stay calm and alert in a crisis. Tip number 3, controlled breathing. How to calm your heart and save oxygen. When fear sets in, your body's first instinct is to panic breathe. Fast, shallow gasps that actually make things worse. During a heart attack, this kind of breathing starves your body of oxygen, increases your heart's workload, and can push your blood pressure into dangerous territory. But there's a simple science-backed way to turn panic into control. And it starts with how you breathe. Why this technique works. The Stanford University School of Medicine found that patients who practiced controlled, slow breathing during cardiac stress had 45% less heart muscle damage than those who hyperventilated. And the Mayo Clinic reported that just 5 minutes a day of breathing practice helped seniors lower heart rate by up to 15 beats per minute and reduce blood pressure naturally. That's because this kind of breathing activates your parasympathetic nervous system, your body's built-in calm down switch. It slows your pulse, relaxes your arteries, and improves the efficiency of every heartbeat. The step-by-step technique. Here's what you do. Right now or any time you feel chest pressure, anxiety, or shortness of breath, sit or recline in the semi-sitting cardiac position from the last section. Place one hand on your chest and one on your belly. The goal. Your belly should rise more than your chest. Inhale slowly through your nose for a count of 4. Fill your lungs completely. Hold that breath for a count of 4. This pause allows oxygen to diffuse more effectively through your lungs. Exhale slowly through pursed lips for a count of 6. Imagine blowing out birthday candles in slow motion. Repeat this for several rounds. Calm, steady, and quiet. This is called paced diaphragmatic breathing. And the longer exhale is what makes it so effective. It helps your body switch from panic mode to recovery mode. In a study published in the American Journal of Cardiology, 300 cardiac patients were divided into 2 groups. One trained in slow breathing, one not. When real emergencies struck, 78% of trained patients successfully used the technique during heart attacks, compared to just 12% in the untrained group. That's why practice matters. You can't learn calm in a crisis. But if you make this breathing technique part of your bedtime or morning routine, it becomes automatic when you need it most. If you're on the phone with 911, count out loud as you breathe. It helps keep your rhythm steady and lets dispatchers know you're still conscious and responsive. They'll stay on the line, coaching you step by step until help arrives. In the next section, we'll cover something almost no one talks about. A practical, life-saving move that can cut emergency response times by up to 10 minutes. It's not about medication or movement. It's about your front door. Tip number 2, unlock your door and signal for help. It sounds almost too simple to matter. But when seconds count, a locked front door can be the difference between life and death. Every year, paramedics lose precious minutes because they can't reach the patient fast enough. And in a heart attack, minutes are muscle. Let's talk about a small, powerful step that could save your life long before an ambulance even arrives. The hidden danger of locked doors. A study published in the Journal of Emergency Medical Services tracked over 8,000 cardiac emergencies. It found that locked doors delayed treatment by an average of 11 minutes, and that 1 in 3 seniors who died from cardiac arrest were unreachable in time simply because rescuers couldn't get inside. Think about that. Not because help didn't arrive, but because help couldn't enter. The door first rule. So here's a rule that could one day save your life. If you feel heart attack symptoms starting, your first move before calling 911 is to unlock your front door. Here's why. Within just 3 to 5 minutes of a major heart attack starting, most people lose the ability to stand or walk. Once you're on the floor, you won't be able to reach the lock again. So as soon as that chest pressure, breathlessness, or radiating pain hits, stand up slowly and unlock your main door. Leave it slightly ajar if it's safe to do so. Turn on all your house lights, day or night, so paramedics can spot your home instantly. Hang a bright towel or cloth on your doorknob or window if it's daytime. A visual signal that guides responders to the right address. These simple steps save 2 to 3 minutes of searching time on average, which can mean the world when your heart is struggling. Extra layer of protection, smart access. If you live alone, consider installing a key lock box outside your home and register the code with your local fire department. According to the National Association of Emergency Medical Technicians, these lock boxes cut entry time by 8 minutes on average. Better yet, some smart locks can be programmed to unlock automatically when 911 is called from your phone. Hospitals and senior care experts at the Cleveland Clinic found that patients with this setup received emergency treatment 31% faster. Make yourself easy to find. When you're in distress, every clue helps paramedics locate you quickly. Keep these items ready. A whistle on your keychain or nightstand. If you can't shout, blow it. A medical information sheet taped to the inside of your front door. Your name, medications, allergies, emergency contacts, large font, clear and easy to read. The American College of Emergency Physicians found that visible info sheets reduced treatment delays by 26%. Why this step is so important. When your heart is deprived of oxygen, every minute lost equals more muscle damage and potentially more long-term disability. By making your home paramedic-friendly, you're giving yourself a 5 to 10-minute head start that could keep you alive until defibrillation or advanced care begins. Next, we'll cover the Mayo 1 tip, the emergency protocol that Harvard researchers say gives you the same survival advantage as having a paramedic right in your living room. It's simple, fast, and proven. And if you have a history of heart issues, you'll want to write this one down. Tip number 1, the nitroglycerin protocol, your most powerful emergency tool. This final tip could be the single most life-saving action you ever learn. Because according to Harvard Medical School, seniors who used nitroglycerin correctly within the first 3 minutes of a heart attack had survival rates nearly identical to those who received immediate paramedic care. That's an astonishing statistic, and one that every person over 60 with heart risk factors should understand. What nitroglycerin does, nitroglycerin isn't just another pill. It's a fast-acting vasodilator, which means it relaxes and widens your blood vessels. That instantly lowers the pressure your heart has to pump against, helping blood flow more easily through partially blocked arteries. In plain English, it helps your heart breathe again. A large study in the British Medical Journal followed 12,000 cardiac patients and found that early nitroglycerin use reduced death rates by 35% and cut heart muscle damage nearly in half. If you're over 60 or have high blood pressure, diabetes, high cholesterol, or a family history of heart disease, talk to your doctor about getting a prescription for emergency nitroglycerin. It's available as tiny tablets placed under the tongue or as sprays used in the mouth. Many doctors recommend keeping it close by at all times because when symptoms hit, seconds count. The correct way to use it: when symptoms start, chest pressure, radiating pain, or shortness of breath, follow this exact protocol. Sit down immediately. Never take nitroglycerin while standing. It can drop your blood pressure so fast that you might faint. Place 1 tablet under your tongue, not on top. Let it dissolve naturally. Don't chew or swallow it. You'll feel a slight burning or tingling sensation. That means it's working. Wait 5 minutes. If your symptoms don't improve, take a second tablet. After another 5 minutes, if you're still in pain, take a third tablet and call 911 if you haven't already. Never take more than 3 doses in 15 minutes. The Cleveland Clinic found that patients who followed this exact 5-minute interval protocol had 67% better outcomes than those who took nitroglycerin randomly or delayed their second dose. Safety warnings you must know. Never mix nitroglycerin with erectile dysfunction drugs like Viagra, Cialis, or Levitra within 48 hours. The combination can cause a fatal blood pressure drop. If you already took an aspirin earlier, as we covered, that's okay. Aspirin and nitroglycerin actually work better together, improving both clot prevention and blood flow. Research from Johns Hopkins University found that this combo increased survival odds by 58% compared to using either one alone. Always store your tablets properly. Nitroglycerin loses potency when exposed to light, heat, or air. Keep it in its original amber glass bottle, tightly sealed, and replace it every 6 months. If a tablet no longer causes a mild tingling under your tongue, it's expired and potentially useless. Keep a bottle in your bedroom, kitchen, car, and purse, but avoid bathrooms or glove compartments where heat and humidity degrade it quickly. Why this matters so much? Nitroglycerin isn't just a medication. It's your bridge to survival. It buys you the 10 to 15 minutes your body needs to stay stable until emergency responders take over. When used correctly, it can prevent cardiac tissue from dying. And that means a faster recovery, fewer complications, and more years of healthy life ahead. You've now learned the 7 science-backed steps that could keep you alive if you ever face a heart attack alone. But there's one final part: how to bring it all together. Practice it and prepare your home and mind before an emergency strikes. That's what we'll cover next. Your heart safety checklist and a message of hope for life after 60. Let's bring everything together. Because the goal isn't just to know what to do. It's to be so prepared that when the unthinkable happens, your body and mind already know the next move. You can't predict when a heart attack might strike, but you can decide how ready you'll be when it does. Here's a quick recap of the 7 life-saving steps you now know. Build your emergency communication system. Speed dial 911. Post your address near every phone. Keep your cell within reach 24/7. Cough CPR, use it wisely. Only if you're still conscious and able to breathe deeply. Never as a replacement for calling 911. Take aspirin the right way. Chew, don't swallow. 1 325 ml tablet, or 4 baby aspirins. Call 911 first, then take it. Adopt the cardiac position. Sit upright at a 45-degree angle. Loosen tight clothes. Stay calm. Breathe steadily. Control your breathing. Inhale 4. Hold 4. Exhale 6 through pursed lips. Focus on your belly rising, not your chest. Unlock your door and signal for help. Open doors. Turn on lights. Make yourself easy to find. Post medical info visibly near your entrance. Use nitroglycerin correctly. 1 tablet under the tongue. Wait 5 minutes between doses. Max 3 tablets. Never mix with erectile dysfunction medications. Don't wait for an emergency to learn these moves. Set aside 15 minutes once a month to review. Check your aspirin and nitroglycerin expiration dates. Confirm your medical info sheet is current. Rehearse your breathing rhythm. Make sure your door key, phone, and alert device are where they should be. Remember, practice turns panic into muscle memory. And muscle memory is what saves lives when fear takes over. If you're watching this, you're already doing something powerful. Taking your health into your own hands. You're proving that aging doesn't mean helplessness. It means wisdom with preparation. As Dr. Michael Rosen of the Cleveland Clinic once said, "You can't stop the clock, but you can slow the wear." And every small act of preparation, every habit, every check, every mindful breath, strengthens not just your heart, but your peace of mind. Share this video with someone you love, a parent, a neighbor, or a friend who lives alone. These simple steps might one day save their life too. Then tell us in the comments, which of these 7 habits will you start practicing today? And if this video helped you feel more confident and informed, subscribe for more trusted, science-backed health insights for life after 60. Because when it comes to your heart, knowledge isn't just power, it's protection. You've got this. Stay safe, stay prepared, and keep your heart strong.